The myeloma world is absolutely bispecific antibody nuts right now. We have all different types, those that target BCMA, those that target GPRC5D, and we're really excited about Cevostamab. It has a newer target called FcRH5, and there's a bunch of very novel things about this study. First of all, there's the target. And one of the things that we've seen with a lot of the BCMA-based bispecifics are high rates of infections. When we move over to the non-BCMA bispecifics like GPRC5D that we're seeing in drugs like talquetamab and furimtamig, the rates of infection seem to be lower. Although GPRC5D does have its issues with some of its target toxicities like dysgeusia and rashes. FcRH5 seems to avoid a little bit of both of that. The other thing is those other bispecifics are given until progression or intolerance. This study, on the other hand, gave fixed duration. So after an initial step-up dosing with Cevostamab, we dosed patients every 3 weeks for a total of 17 cycles, which roundabout comes to about 1 year of therapy. The patients are then observed off of therapy and at the time of relapse are allowed to go back on treatment, which is kind of a novel way of approaching this. Now, first of all, we've had amazing results of patients who have completed the 17 cycles, and anyone who has achieved a stringent CR or better at the end of 17 cycles has not yet relapsed on the study off of therapy. These are people that have had many lines of therapy and are now sometimes 1, 2, we even have a patient approaching 3 years off of therapy who has been previously treated with everything, so kind of amazing. So far, we've retreated a few of these patients that have relapsed, about 6 of them, and so far about 5 of them have responded to the retreatment. The responses so far aren't as deep, but they're holding stable, a lot of stable disease and minor responses. Overall, we're really excited about this data and looking forward to new combinations because it seems to be a very effective way of treating heavily relapsed patients.